Okay, this one caught me by surprise, and maybe I'm out of the loop a little bit, but there's a drug, a substance that's being sold at Utah gas stations and service stations, and it's called Kratom, Kratom. And some people describe it as gas station heroin. Supporters of the drug say it's a natural remedy that helps with pain and addiction. For the next couple segments, we're going to be breaking down the arguments for and against the ban, or proposed statewide ban on kratom. And the American Kratom Association is going to join us at 10:20 to discuss their perspective.
I'm shaking my head at you because we asked for pronunciation because I didn't know either, but I've been told it's kratom.
Okay.
So we're going to ask Senator Mike Mckell what he thinks. So thanks for joining us, Senator.
Hey, thank you for having me on. And Greg, I'm really happy you didn't know about the drug. It is kratom. I'm glad you've got me on before the Kratom Association. I mean, let me tell you, they're out to sell a product. They're gonna pitch a good story. But what I've done so far is I've actually got feedback from experts. We had a committee hearing. We had all of the experts in the state. So don't take my word for it. I'm happy to talk through. But it is kratom, and I just want to start off right off the top. This is from the FDA. Kratom is not appropriate for use as a dietary supplement. Therefore, kratom is not legally marketed in the U.S. as a drug product, a dietary supplement, or a food addition in conventional food. Let's jump into it. Ask me anything you want.
Okay. Let me ask you first, why is it being sold at gas stations, and why are we calling it now gas station heroin?
Well, it's interesting. We call it gas station heroin. I was at a dinner last night with a lawmaker from Louisiana. They had just banned it, and that's the term they use. That's the term I use. Unfortunately, this is where I regret a vote that I made years ago while I was still serving in the House. We passed the Kratom Protection Act. It authorized kratom to be sold in the state of Utah. It's expanded out. It's being sold in the state of Utah. It's in a lot of states. States that have passed it have now banned it. I was with a lawmaker from Louisiana and Connecticut. Both of those states have just banned it. Comes from Southeast Asia. Several nations in Southeast Asia ban it entirely. They've had hundreds of years of that long history with the product. They know how harmful it is. But I'm going to call it gas station heroin. That's what it is. It attacks your opioid receptors exactly the same way. I hope we get a chance to talk about some of the data we learned in the state, but people are dying from kratom, and it's showing up in our overdose deaths, and it's a really dangerous product.
How is it being marketed, Senator? I mean, and I've like I said, I've never seen it, but it's obviously being marketed, or we wouldn't be having this conversation.
Mm-hmm. Yeah, you've probably seen it. You just didn't notice. It's on the counter at Maverick. I mean, that's how it's being marketed. It's literally at the checkout counter next to 5-Hour Energy, and these products. I don't want to go into too many details. I don't want new people using this product, right. But smoke shops online. There are. So I kind of did a survey, and I don't want to say I did a survey. I went on my own investigation. I drove around the legislative district I represent, and I bought kratom to have it tested. And I mean, I can tell you every gas station in Spanish Fork that sells it or doesn't sell it, but that's where it's primarily sold, including smoke shops, and a bunch of it sold online.
Are there different strains being made other than what the natural substance would be if you found it?
Yeah, almost every strain that people are buying are not the natural kratom. And that's, look, they're going to come on. They're going to tell you how wonderful this plant is. But what I did is I asked every clerk when I bought kratom, I said, I want you to sell me what people are actually buying. Sell me the most popular version of kratom. And then I had a chance to meet with Dr. Brandon Forsyth up at the state lab. We had a lot of these products tested, and the most popular kratoms, the kratoms folks are buying, it's extracted. It's become way more potent and way more addictive and way more harmful.
Is that because they're adding synthetic ingredients to it? I mean, I understand, and again, I'm like Greg. I didn't know anything about it until I started seeing on your social media that you're like, hey, I didn't know how bad this was. Yeah,
it's bad news. Well, what they're doing is they're extracting it, making it more potent. And when they come on, they're going to tell you about a drug called 7-OH or 7-hydroxy. And it is really dangerous, and I think we all agree that it's really dangerous. But what's interesting is the metrageny, that's an alkaloid in the kratom itself, is also very dangerous. And don't take my word for it. We did a committee hearing. The state lab, the director himself, Brandon Forsyth, as he's been looking at these products, one of the conclusions he's reached, and some of our other experts that came in, is the alkaloid in kratom, the main alkaloid, the metrageny itself, is also very, very dangerous. And I've heard the industry say it would take a truckload of this alkaloid to get somebody addicted, to get somebody high, and that's nonsense. That's not true. Right now, I want this to set in. We had the Megan Brokemeyer. She's the drug overdose prevention research coordinator for our DHHS state of Utah. She brought data, and right now we have at least 158 kratom-related overdose deaths where kratom was in that person who overdosed. And those numbers of that drug have actually gone up 43% over the last 5 years in these overdose deaths we're seeing in the state of Utah. So it's showing up in a very big way, and it's a scary substance. It just, the way it's being marketed is safe. It's not a supplement. When you go to buy your supplements, I don't know anybody that says, well, I think I want to go get my supplement at the gas station and, conveniently right next to the 5-hour energy.
So Mike, how is it being, what is the FDA doing? Is there no federal legislation or federal regulation of this right now?
Not very much. It's catching up, and there's been an effort nationwide to really focus on stuff, and that's what the industry is going to tell you, that the problem is 7-hydroxy, and they're right. It is a problem, but it's both. The FDA is tackling that, but the guidance from the FDA is, it is clear. Quote, kratom is not appropriate for use as a dietary supplement, end quote. The FDA has looked at it. They've been really clear. The Mayo has done some really good research, and just to warn the public, when they come on, they're going to talk about some research. A lot of that research was actually funded by these folks selling the product. So when they come on and they talk about how safe it is and the research that was done, I want to be clear that a lot of that research is coming directly from the industry itself and the Kratom Association. Dollars are being used as marketing dollars to do research, and I think we see that in a lot of products, but I think you're going to hear that when they come on.
Can I ask you a question about how this relates to maybe the psilocybin conversation that's been happening on Utah's Capitol Hill? So magic mushrooms, right?
Yeah.
Are you talking about maybe classifying or restricting the use of kratom under the supervision of a trained professional, or you are just looking for a straight out ban?
Yeah, so what I do is I schedule the two alkaloids, the 7-hydroxy as well as the metrageny, and that, if somebody wanted to go down that road and go through that medical process, that doesn't close the door. I've talked about a ban, but the ban is selling it the way it's being sold today. Certainly if somebody wanted to go down that road, they could. But what I think is you shouldn't be able to sell an opioid in a gas station. I think that's really clear. And let me just throw out another argument. You're going to hear about people who come off opioids, and they're able to come off opioids by taking kratom. And that shouldn't surprise anybody that you can replace one opioid with another. Your opioid receptors are impacted the exact same way with kratom. So when they argue, and people who are selling this product, they argue this is a safe way to get off opioids. I don't think converting from one opioid to another opioid is ever safe. And anytime opioids are involved, to your point with the psilocybin, medical marijuana, we involve professionals, we involve doctors, we involve some oversight to make sure it's not just peddled at a gas station.
Yeah, thank you so much for joining us. That was Senator Mike Mckell talking to us about proposals on Utah's Capitol Hill to ban or at least restrict kratom. And when we come back, we're going to talk with the Kratom Association and how they say it can be used beneficially. So stay with us.
Inside Sources.
Let's follow up on our conversation about kratom. Utah Lawmaker says that that even though it's a natural remedy that helps with pain and addiction, it should be regulated, and a Utah lawmaker is actually trying to ban it. We just heard from Senator Mike Mckell, who's sponsoring legislation to do that. We now have joining us Mac Haddow, Senior Fellow on Public Policy for the American Kratom Association. Mac, I'm sorry, I'm not going to pronounce that word wrong anymore. But can you tell our listeners what it is?
I can. Thank you for this opportunity. Kratom is a plant that's grown naturally in Southeast Asia, has been used for centuries there safely by people. It came to the United States just after the Vietnam War when our soldiers who had used it in order to offset the long, hot days in the jungle, gave them energy boost and increased focus. We had a massive immigration of the Hmong population where kratom was a part of their diet. So it was introduced to the United States and has been used safely in America since that time.
And so today, it's something you can just buy over the counter at a gas station. Is that right?
And at health food stores. And yes, you can buy a number of products that are very helpful to you at gas stations. You can also buy products in the state of Utah that are very bad for you, including cigarettes and alcohol. You regulate those things to make sure kids can't get them and make sure that they're properly labeled. And that's what the existing Kratom Consumer Protection Act does.
So let me just ask you this. It's being called gas station heroin, which to me makes it sound like I should be concerned. We're also hearing some data that it can be very, very addictive. What can you tell us about its addictive properties?
Well, let me first say that I have immense respect for Senator Mckell, and I understand what he's trying to do, but he was quoted in the Deseret News when asked whether he would work with the association. He said that's not going to happen. It needs to happen because what Senator Mckell told you on this gas station heroin is not accurate. If you look at the FDA's characterization of gas station heroin, they're talking about 7-OH, which is a chemically manipulated opioid that is derived from a metabolite in the kratom plant. It is not kratom. And I think he's wrong about that. And if he would talk to us and not just lock the door on us, we could explain that. But there are a couple of other things that Senator Mckell said that are equally not true. He said that the Mayo Clinic has done really good research on kratom. They have not spent one penny of research on kratom. They simply repeat what the FDA in the past has said. But importantly, and what Senator Mckell needs to understand, the FDA has changed their position on natural kratom leaf products dramatically because they now have identified that 7-OH, gas station heroin, needs to be scheduled at the federal level, and they announced that on July 29th. Now, on the safety, the reason the FDA has changed their position, that they previously had been anti-kratom, is that they conducted their own FDA dose-finding study. Senator Mckell told you a lot in this interview what you were going to hear from us. We're a consumer-based organization, not an industry group. He said that the FDA dose-finding study was funded by industry. That's not true. It was funded by the FDA. It was independently done by an agency that had a bias against kratom, and what they found is that kratom is well tolerated at all dose levels. And if you look at the kratom death statistics that were quoted by Senator Mckell, they misstate the reality and the truth. Those overdose deaths consistently involved polydrug use. That's a problem in our society where you have people that are using illicit drugs, and some of them may be using kratom at the same time, some to withdraw from those illicit drugs, but that's not what caused their deaths. And you can look at the FDA website. You can look at the National Institute on Drug Abuse website. Both consistently say, from a federal government position, that kratom deaths are rare, and when they do occur, it is because of adulterated products or polydrug use. We don't go in and ban Tylenol because someone adulterated or manipulated a Tylenol product like they did in Chicago a couple of decades ago. We regulate that product, and that's the response that we should be using here. There are bad kratom products on the market that are masquerading as kratom that are actually gas station heroin. There are some extremely potent kratom products that are masquerading as natural kratom leaf products. We need to regulate them. Banning them is not the solution, and Senator Mckell is simply wrong on that point. I hope he'll sit down and talk to us.
We're speaking with Mac Haddow, Senior Fellow on Public Policy for the American Kratom Association. Mac, let me ask you kind of a two-part question. One, how does the FDA currently treat kratom? And two, you mentioned the Kratom Consumer Protection Act or something. Can you tell us, I'm sure I butchered the name, what that is?
So you can go to Commissioner McCary's statement when asked directly in the July 29th press conference what the difference between natural kratom leaf products are and 7-OH. And he said the difference is night and day. He called 7-OH gas station heroin because it is. It is an opioid. Kratom is not. Senator Mckell is wrong again. Kratom is not by legal definition nor by chemistry an opioid. It is a partial agonist, as many substances are, that does not go to the euphoric high center of your brain, nor does it cause respiratory suppression. And there are numerous NIDA, National Institutes on Drug Abuse, studies, over $100 million of NIDA-funded studies, government taxpayer-funded, that will corroborate what I've just said to you. And the idea that this is all funded by industry is a myth. And I hope that Senator Mckell will sit down and talk to us about it. The Kratom Consumer Protection Act is our effort to regulate kratom because we were having a hard time at the federal level getting the FDA's attention. We started in 2019. Utah was the first of now 18 states that have enacted a Kratom Consumer Protection Act. It regulates kratom, the formulation of the products, it requires good labeling, and it age restricts access to it. That's what Utah did, and they are the pioneer in the country, and we're seeing more and more states do it. And I'll just give you an example. Senator Mckell said he talked about Louisiana that just banned it. Rhode Island reversed their ban and adopted the KCPA. But the Louisiana House member who stood on the floor and was asked the question, what about these synthetics? And Representative Villillo said, and I've got a tape of it, said there's no such thing as a synthetic. And yet that's what the FDA now has identified as the true problem in the kratom space, these masquerading products that are 7-hydroxymitragynine, 7-OH, that are opioids, full-blown opioids, because they're chemically manipulated. That's what we need to do to protect the public, and we need to make sure we stop them in the state of Utah. And Senator Mckell's bill partially does that. He wants to ban 7-OH. That's appropriate.
So just to clarify, what does regulation look like to you? Because it sounds to me like you're really in favor of regulating because there are some adulterated forms. What does that look like to you?
Two levels of regulation. One is that the product that is sold to a consumer cannot contain more than 2% of the overall fraction of the product as 7-OH. That means that it's not chemically manipulated. Trace amounts of 7-OH do occur in the drying process of creating raw materials. And the FDA identified that. Commissioner McCary said it clearly, not even a question about that. So that's the first regulation. And secondly, we don't allow for any kratom product to be extracted without using FDA-approved food-grade solvents that do not exceed what's called the USP 467. That protects consumers. And Senator Mckell is wrong on this point about these extracted products. Those that are violating that standard need to be removed from the marketplace, and we'll work with him on that. And currently, there's one other addition that we could add to the Utah law, which would say that you can't sell a 7-OH product that's greater than 1 milligram in a serving size. That is a protection that needs to be added to the Utah law, and we would like to work with Senator Mckell on that.
Thank you for joining us today. We were talking with Mac Haddow, Senior Fellow on Public Policy for the American Kratom Association, and we also heard from Senator Mike Mckell in our previous segment on why he believes this is so dangerous and addictive. So now we have both sides of the story.
Right, regulation versus preclusion altogether. We'll see which side prevails. And I guess we may have 50 different rulings from 50 different states on how kratom is being marketed and sold and regulated within those states.